Welcome to the Prime News Report. And now, here's your host, Linda Schreiber.
In this segment of the Prime News Report, we'll be taking a look at newborn screening in Illinois, what it is, what it can mean to your newborn, and how the state of Illinois provides screening for 6 serious conditions. Our report, Checkup for Life, begins with a look at 6 rare conditions screened for across the nation, how often each occurs, and what this can mean to the parents of a newborn. Prime News health correspondent Christina Lopez has that story. Christina?
A healthy baby. It's the wish of every new parent. Medical science is continuing to make that wish a reality. Newborn screening is one of the tools used by the state of Illinois to protect infants from 6 rare genetic and metabolic conditions. Newborn screening means healthier babies and a healthier population. These conditions are errors in body chemistry that usually show no outward symptoms, but can seriously affect the life and development of a child. Specifically, what are the diseases being screened for, and what can be done about them? I spoke with Dr. Henry Lee, who tells us.
The disorders tested for in the neonatal period by the state of Illinois are biotinidase deficiency, congenital adrenal hyperplasia, known as CAH, galactosemia, congenital primary hypothyroidism, phenylketonuria, better known as PKU, and certain hemoglobinopathies, including sickle cell disease. We found that if detected early, all these disorders can be treated with a high degree of success.
Let's take a more in-depth look at each of these disorders. First, biotinidase deficiency. This disorder may occur about 1 time in every 40,000 to 100,000 births.
Basically, biotinidase deficiency is an enzyme deficiency that causes inefficient use of vitamin B. Untreated, it can cause hair loss, skin lesions, hearing loss, poor muscle tone, and developmental delay. When detected, biotin, a component of vitamin B, can be given as treatment.
CAH, properly referred to as congenital adrenal hyperplasia, is a genetic disease that can occur in 1 out of every 15,000 births.
This problem causes a lack of the sugar-producing hormone called cortisol and may cause a lack of salt-retaining hormone. The effects of CAH are severe dehydration and reduced weight gain. Treatment is easily undertaken by supplying the affected patient with cortisone at a level that the body would normally produce and by replacing salt in the body.
Galactosemia is quite rare, occurring in approximately 1 out of every 40,000 newborns.
With galactosemia, the body is unable to use the part of milk sugar called galactose. The resulting buildup of galactose in the system can cause many problems, including liver and brain damage. Since we can detect this disorder so early, it's possible to begin treatment by putting an infant on the right diet before any damage occurs. This change in diet usually means replacing breast milk or regular formula with a specially prescribed soy formula.
One of the most common neonatal conditions that Illinois screens for is congenital hypothyroidism. It may occur in as many as 1 out of every 4,500 newborns.
As the name implies, hypothyroidism means that thyroid hormone is low or absent due to a poorly developed thyroid gland. The effects of hypothyroidism can be dramatic, since the correct level of thyroid hormone is necessary for the brain and body to grow properly. Hypothyroidism, left untreated, can cause physical and mental retardation. If we diagnose it early enough, as in the case of neonatal screening, hypothyroidism is easily treatable through thyroid hormone replacement.
Known commonly as PKU, phenylketonuria may occur in 1 out of every 12,000 births.
PKU is an inherited enzyme deficiency that prevents the affected newborn from properly utilizing one of the amino acids in protein. Without early testing, it may take several months before the effects of PKU become visible. By then, a child may be suffering from both mental and physical delays brought on by high levels of phenylalanine. The only treatment for PKU is a medically prescribed diet, and it must be started very early in life to prevent irreparable damage.
Sickle cell disease is probably the most widely recognized of the disorders tested for. Sickle cell disease and related hemoglobinopathies will affect approximately 130 infants each year. That's 1 in 1,500 Illinois children. Although the disease is more common in African Americans, It can be seen in individuals of almost every ethnic background.
Sickle cell is an inherited blood disease that causes pain and may damage vital organs. Children with sickle cell are also very susceptible to infection. Antibiotics, immunizations, and counseling for living with sickle cell disease are all essential parts of an early and continuous treatment plan. The good news is that today's preventive treatments for a sickling disorder have prolonged and improved the life of a child with this problem.
The effects of the disorders tested for by the state of Illinois, if untreated, can be frightening. Even more frightening is the fact that these diseases are not usually visible in newborns and don't show outward effects for weeks or even months. The good news is that when detected early, these diseases are treatable. And if your child is diagnosed with one of these conditions, consultants and specialists are available through the Illinois Department of Public Health to provide you with treatment and management. I'm Christina Lopez with Prime News.
Thank you, Christina, for that report. Something you didn't touch on, why these 6 diseases?
Well, Linda, that's a good question. Actually, since the early days of the testing program, more disorders have been added to the screening roster. The criteria for screening for a certain disorder involves how early it can be detected, how severe or damaging it may be later in life, and how treatable it is. These 6 are all severe, all detectable early, and can all be treated. In the future, other diseases may be added to the testing procedure, but for now, these 6 carry the most success for early detection and treatment.
Thank you, Christina. Next in our report on Checkup for Life, Sheila Thompson takes a look at the actual testing procedure, what happens when your child is screened, and how you can help assure accurate and valid testing.
It's called the heel stick, and it's the most common method for obtaining a blood sample from an infant. There is some discomfort associated with the procedure, but it's brief, and considering the benefits, it's worth it. Early detection is made possible by obtaining a few drops of blood and placing them in one of these special filter paper cards. Since the results are reported to your doctor, it's important that you provide your correct name and phone number so you can be contacted in the event a retest is needed. Hospitals and maternity facilities throughout Illinois are required by law to collect the sample. Once a sample has been collected, it's sent to the Illinois Department of Public Health Lab in Chicago. Here, the samples are tested, and a report is made back to the hospital, usually within 7 to 10 days after the collection date. Because of the time involved in the screening procedure and the need to start treatment as soon as possible with an affected newborn, early collection is vitally important. A sample is taken at least 24 hours after birth or before the baby goes home. If your baby is discharged sooner than 24 hours after birth, he or she will need a retest. If you deliver at home, it's very important that you make arrangements to have the test done. Remember, early testing is vital, and the result, healthier babies. I'm Sheila Thompson for Prime News.
Sheila, you say this test is a state law in Illinois?
That's right. Exemptions are allowed only for religious reasons when a statement is signed by a parent. But since the procedure is fairly easy to perform and the results are so valuable, healthcare officials highly recommend going through with the test. And even though it is the law, it's still a good idea to verify that your health facility plans to perform the test.
You mentioned a retest.
If needed. You have to remember that these tests can sometimes be simply inconclusive. A retest doesn't necessarily mean that there's a problem, just that more information is needed. If you need a retest, it's important to get that done as soon as possible. You may wish to contact the public health nurse in your area to help with arranging the retest.
Thank you, Sheila. Up next, coping with a confirmed diagnosis. John Pierce talks to children and their parents who are coping with one of these devastating diseases.
This is Carl. He's 17 years old, and you'd never know that he was diagnosed with PKU as an infant. Based on the results of the neonatal screening and further laboratory studies, specialists were able to successfully diagnose Carl's condition and start him on a treatment of medically prescribed diet products provided by the state health department.
There's really no restrictions. There's nothing I can't do that a person without the diet can do. It's just when I go to places with friends or something, I have to remember, what I can and can't have, and no one really cares as long as you're there, that they enjoy it. There's been no restrictions ever.
I guess the initial shock of finding out that you have PKU, it's, I don't know if you'd use the word devastating, but I mean, it certainly made you stop and think, but at the same time it made you very grateful that it was a condition that you could handle with something as easy as diet. You know, you don't have the expense of a lot of medication or anything like that.
I basically tell everyone that I'm a medical vegetarian and I can't eat foods high in protein, and they leave it at that. Sometimes it's hard when you get hungry and the diet's very limiting and you'd like to eat more, but sometimes you have to just control yourself.
It takes a load off your mind when you see, okay, there is nothing going to really be wrong, just follow the diet.
Haley is 8 years old. As an infant, she was diagnosed with congenital hypothyroidism.
Other than taking the routine blood tests every 6 months and keeping her on her medicine and making sure that she takes her medicine every day and doesn't miss a dose, there really isn't much more to that. I mean, it's a very manageable, very controlled, disorder to have. Very, out of all the disorders that she could have been diagnosed with, I bless God that, she got this one because it is so manageable.
Danielle will be turning 6 in just a few weeks. She is a happy, and for the most part, very healthy 5-year-old, thanks to the preventative antibiotic treatments she has been receiving since her diagnosis for sickle cell disease. She seems to have fewer respiratory infections than her older siblings, who are also affected, and she has only been admitted to the hospital once.
We started treatment just a few weeks after she was born, and we still attend counseling and keep up with her medicine. The doctors say her future looks good.
Carl, Haley, and Danielle are just 3 examples of the hundreds of children diagnosed each year with a congenital disorder. As you can see, these conditions, although catastrophic if not treated, can be managed if detected early. I'm John Pierce for Prime News.
Great report, John.
Meeting these kids and their families was really enjoyable. They're so happy and active and well-adjusted. It's hard to think of them as having some serious medical problem.
Carl's father mentioned how normal he looked as an infant. Is that always the case?
Usually it is. Some of these disorders take weeks or even months to become apparent. Really, the fact that these kids do look normal at birth is one of the dangers. By the time the disorder becomes visible, damage may already be done, and that's why early screening is so vital.
Thanks, John. Could your baby be affected by a neonatal disorder? Let's check the numbers. More than 190,000 babies will be born in Illinois this year. Of that number, an estimated 200 will be found to have one of the genetic or metabolic disorders screened for by the state of Illinois. That puts the chances of your child being affected at approximately 1 in 1,000. Not a great likelihood, and that should be a comfort to expectant parents. Does this mean that screening is not necessary? Absolutely not. Based on research compiled through 30 years of testing, it has been found that there are no pre-indicators to signal the occurrence of such a disorder. There is also no correlation between the age of parents or the mother's habits during pregnancy that could predict one of the conditions. Even parents who may already have healthy children could have a baby with a problem. As you've heard before, the only protection against the effects of these disorders is early detection and a program of treatment that begins virtually at birth. Don't be misled by the low numbers of these disorders. Check with your healthcare provider and make sure your baby is tested. That concludes our report, Check Up for Life. If you would like further information on newborn screening, talk to your healthcare professional or contact the Illinois Department of Public Health. I'm Linda Schreiber. Thank you for watching.
Prime News is a production of the Illinois Department of Public Health.